Hello everyone, welcome to my channel. Today I will discuss abdominal pain in children. Abdominal pain is incredibly common in children. Most of the time there is nothing serious at all and it is just from a mild stomach bug or some constipation or hunger. Or it is a child's way of getting out of something they don't want to do. But an abdominal pain can sometimes be a sign of a more serious problem. Here are 18 signs that a child's abdominal pain could be something serious. First is the sick appearance of the child. As a general rule, if the child looks very ill, in addition to being in pain, medical help should be sought. Often the caregiver just knows the child is sick. Key things to look for when abdominal pain occurs include pale appearance, sweating, or a child who is sleepy or listless. It is most concerning when a child cannot be distracted from the pain with play or refuses to drink or eat for several hours. Number 2 is there is blood in the stool. Most of the time we see blood in the stool with constipation, which is usually not serious and can be easily treated. But a bad stomach ache with blood in the stool can be a sign of serious infection, inflammatory bowel disease, infectious enterocolitis, or another intestinal problem. The classic Groin jelly stool often is seen in patients with intussusception. So anytime your child has an abdominal pain and blood in the stool, give your doctor a call to be on the safe side. Next is child vomits blood. As with blood in the stool, this isn't always a sign of something serious. Children who have been vomiting a lot can sometimes vomit some blood, and children who have nosebleed or bleeding from a lost tooth or some other problem of the mouth may vomit that blood back up. But as with the blood in the stool, any abdominal pain with vomiting blood requires a call to the doctor. Number 4, there is green or bilious vomiting. Green vomit can be a sign of blockage in the intestine. Sometimes people vomit some yellow-green material when they have been vomited up everything else. But abdominal pain and green vomit should never be ignored in children. Number 5, child has hives, look pale, complains of dizziness, or has swelling of the face. Anaphylaxis, the most serious kind of allergic reaction, can cause abdominal pain, often with vomiting. If your child has a known allergy and you have epinephrine at home, give it while you wait for the ambulance to arrive. The number 6 is pain in the right lower side of the belly. That's where the appendix is. Early on, the abdominal pain of the appendicitis is usually around the belly button, but then it moves to what we doctors call the right lower quadrant. Now, constipation can cause pain there, and girls who get periods can have pain there when they ovulate, but we don't like to miss appendicitis. So any pain in that part of the belly should get checked out. Now next is child has a fever, a bad cough, shortness of breath or chest pain. Pneumonia can sometimes cause abdominal pain, and many viruses can cause abdominal pain along with the cough. But if the cough is particularly bad or the abdominal pain is getting worse or the child seems to be breathing quickly or otherwise differently, call the doctor. In addition, Kussmaul's respiration indicates diabetic ketoacidosis. Next important point is child says it hurts to urinate. Abdominal pain associated with any trouble urinating, such as painful or frequent urination, urgency and malodorous urine, could indicate a bladder infection and is a reason to seek medical care. Sometimes an abdominal pain can be an only sign of a urinary tract infection. Now number 9, child seems much sleepier than usual. Abdominal pain can be a sign in serious infection, and being very sleepy when you are in pain can be a sign not just of infection, but of low blood pressure or blood loss. Extra sleepiness should always be checked out, but especially if there is an abdominal pain too. Now next important point is child has a high fever. Fever indicates an underlying infection or inflammation. High fever with chills is typical of pyelonephritis and pneumonia. Fever at the onset of acute illness is less likely to indicate a surgical abdomen, whereas fever after the onset of vomiting or pain is consistent with developing peritonitis. Another important sign is longer duration of the pain. An important thing to remember is that most simple causes of abdominal pain do not last very long. Most of the children have experienced gas pain or the stomach gut flu, and remember that the pain usually was gone within 24 hours. Any abdominal pain that continues longer than 24 hours should be evaluated by a physician. Next important point is child having groin pain. One serious problem that a boy may describe as abdominal pain actually comes from somewhere else. It is testicular torsion, a condition in which a testicle twists on itself and cuts off its own blood supply. The child may be embarrassed to mention the location, so you should ask if there is any pain down there. A testicular problem is usually easy to fix if treated early. So if a child complains of pain in the groin area or testicle, seek emergency medical care. Now number 13, abdominal pain associated with rash. Certain serious causes of abdominal pain also occur with a new rash. Joint pain, rash, and smoke-colored urine suggest Hinox-Schönlein purpura. So the combination of a skin rash with abdominal pain is a reason to contact your doctor. Now another important point is failure to pass flatus or feces. An intestinal obstruction is a blockage that prevents food or liquid from passing through the children's small intestine or colon. Causes of intestinal obstruction include volvulus intussusception, incarcerated hernia, and post-operative adhesions, or if the child swallows an object. Now, common symptoms include abdominal pain that comes and goes and is located around or below the navel. There may be constipation, inability to pass gas, swelling of the abdomen, or vomiting. So, seek immediate medical attention if children are suspected to have an intestinal obstruction. Now, another important thing is history of recent trauma. Abdominal trauma can be accidental or intentional. In children, blunt abdominal trauma is more common than penetrating injury. Now, abdominal injury may cause musculocutaneous injury, bowel perforation, intramural hematoma, laceration, or hematoma of the liver or spleen, and avulsion of the intra-abdominal organs or vascular pedicles. Cullen signs, that is bluish umbilicus, or grey Turner sign, that is discoloration in the flank, are unusual signs of internal hemorrhage. Now next important point to note is whether child is losing weight. It is not uncommon for a child to lose a little weight from vomiting or diarrhea. Usually they gain it back once they feel better, but if a child who gets an abdominal pain is steadily losing weight, for example their clothes no longer fit, then they should be thoroughly checked out by the doctor. Now another important point, that child having polyuria and polydipsia with abdominal pain, because it may suggest diabetic ketoacidosis. And the last important point, child with jaundice. It may suggest hemolysis or liver disease. Pallor and jaundice along with the abdominal pain may point to the sickle cell crisis. Okay friends, thanks for watching. Please like, share, comment and subscribe to my YouTube channel for more informative health videos.